Hey everybody, it's Manny Mustakakis again, coming to you from my house in Long Island. It's a Saturday afternoon, and I wanted to get back to the risk factors for heart disease. February is Heart Disease is Heart Month, and particularly Go Red for Women Month. And I wanted to get back to the next risk factor in this series of risk factor videos that I've been doing. The next one is going to be this one's going to be about smoking. Smoking is a tough one for me because I've never been a smoker, and so I don't understand everything about or anything about quitting smoking, about the addictive nature of nicotine. I can give a lot of medical advice about it, and I can tell you that it's bad for you, but I think everybody these days knows it's bad for you. But it's hard for me to really relate to patients in my office when we talk about the importance of quitting smoking, because it's hard. Nicotine is incredibly addictive, and that's something that I admit to all my patients that I just can't relate to. But today I want to talk about what the statistics are for smoking, what the statistics are for quitting smoking, some of the actual health issues that are involved with it, and then at the end I'm going to talk a little bit about e-cigarettes, because I had a friend this week who asked me about e-cigarettes, and I really didn't know that much about it, and so I did a little bit of research into it, and I think I'll spend a little bit of time at the end talking about e-cigarettes. As with all my videos, I hope that you guys will post comments below, tell me where you're watching from, and for this one in particular, if you are a smoker or a former smoker, post your own strategies, post what has worked for you, because that's really a lot more valuable than anything I can say. So to start off, in terms of the risks of smoking, I mean, this isn't the 1960s or the 1970s. There was a time where people did not understand that smoking was bad for you. But I think in this day and age, it's long since been established that, we know it's bad for you. How bad? Well, I mean, smoking probably in terms of heart disease and stroke increases your risk by as much as 4 times of developing heart disease and stroke, and by dying of heart disease and stroke. Obviously, lung diseases, chronic lung diseases like emphysema and COPD, pretty much all cancers have an increased risk associated with smoking. And then a lot of things that maybe don't immediately come to mind: infertility problems, GI problems, things of that nature. So obviously there's a lot of things that we know that cigarette smoking is bad for, but I think one misconception that comes up a lot is the idea that, especially in some of my older patients, that they've been smoking forever and then it doesn't really matter at this point later in life because the damage is done. And that's just not true. There's a whole load of scientific data that's available that confirms that it's really never too late to quit smoking in terms of reducing the risks of bad things that are involved with it. It's estimated that the risk of developing heart disease or dying from heart disease can be cut dramatically within 1 to 2 years after quitting smoking, that the risk of several types of cancers, and I won't belabor all the different types, but the risk of several different types of cancers can be reduced within 5 years of quitting smoking, and certainly some of the risks of chronic lung disease can be minimized by quitting smoking. So there's plenty that can be done. It's really never too late to quit, but the factor is really the motivation to want to quit. So when I talk to my own patients, a lot of times the first question I'll ask them is, do you want to quit smoking? Because someone has to be motivated to want to quit. If you don't want to quit, then there's not really a big point in having the discussion. But there's a large group of people who desperately want to quit, but they don't know how, or they've been unsuccessful. And so that's where I want, one, both your own advice from all of you out there who've successfully quit, and two, I'll talk about a couple of strategies that have been proven to help, scientifically speaking. So probably 3 or 4 strategies that are in mainstream use out there. One is the cold turkey, which is basically willpower, which is basically just quitting. That is incredibly difficult, and usually on average it doesn't work the first time. In fact, most of my patients, I will tell them that the average smoker takes between 7 and 9 tries to quit smoking successfully. That is data that's published. So I tell people that because I don't want people to get discouraged. They say, I tried, something happened, something stressful happened in my life, I relapsed, I quit for a couple of weeks, and then I relapsed. And people tend to get frustrated. It's really not something to be frustrated about, because we know that it takes a lot of tries. Number 2 is nicotine replacement. That's probably my favorite. My favorite strategy is nicotine patches. Nicotine patches deliver a low sustained level of nicotine that can really help bridge people to successfully quit. There are studies that show that it is up to 50 to 60% increase in efficacy in terms of helping people quit. You're 50 to 60% more likely to quit successfully if you try nicotine patches, for example. Obviously, I tell people don't use the patch and continue to smoke at the same time. That's really not very helpful. The next strategy is medications. The two main medications in the United States go by the brand name Chantix and Zyban. Personally, I've shied away from prescribing medications. There's been a lot of controversy over the years about potential for increased risk in mood disturbance and suicidal risk. In 2016, late in 2016, the FDA did sort of soften up the warning on suicidal, the risk of increased risk of suicidal thoughts and mood disturbance that was associated with Chantix. But, you know, for me personally, just my own strategy has been to sort of shy away from that strategy because it's a little bit, that's a little bit difficult. I'm not a mental health professional, so it's not something that I personally am that comfortable with getting involved with my patients. But it's, you know, look, you talk to your doctor, you talk to a mental health professional if you happen to have one, and ask them about it, because certainly the risks associated with smoking are incredible too. And then the last thing I'm going to talk about is with respect to e-cigarettes, because electronic cigarettes to this point have not been shown in any studies to improve the chances of being successful in quitting smoking. So as a strategy for quitting smoking, I don't know that there's anything we can say that it's helpful. But what about e-cigarettes in general? Because there's a lot of questions out there about, are they safe? Are they less safe than cigarettes? Are they as unhealthy as cigarettes? And I don't know the answer to that, and I don't think anybody really knows the answer to that. There is not any long-term data on the safety of e-cigarettes because they just haven't been around as long as conventional cigarettes have been. I think it's pretty clear that they're probably not completely safe. There are low levels of a lot of the harmful agents that are found in cigarette smoke. There's a lot of there are low levels, but as you heat the vapor to higher temperatures, there is some suggestion in some studies that those levels of those agents can be higher. And that's pretty much the extent of my knowledge on e-cigarettes. I'm not really going to speak to something that I don't really know that much about, but all I will say is that two things. One, they probably don't help you that much as a bridge to quitting smoking, and number two, they're probably not, I think it's clear to say they're not 100% safe. Are they as dangerous as conventional cigarettes? There's no way to know at this point. So that's pretty much what I'm going to say about cigarettes at this point. I welcome you guys to to engage in the discussion. I would love to hear what your strategies have been that have been successful. There's a lot of great information at the cdc.gov website. You know, it's there's so much information out there. I think at the end of the day, and what I hope that you guys will take from this video is that, you know, as a physician, my first goal towards my patients when it comes to the smoking discussion is to let you know that, look, I'm not here trying to judge you, okay? Because a lot of my patients will look at me with sort of a shameful look if I ask them if they're smokers or if they're still smoking. And look, I'm not trying to make you feel bad. I mean, everybody, you know that it's not good for you. It's not something that you know, my job is to provide medical advice and to give you opinions and help in quitting as much as I can. But again, at the end of the day, whether it's through this video or through my actual patient practice, my number one goal is to let you know that I'm not trying to judge anybody, and I'm not here to judge you when it comes to smoking. It's just I'm trying to engage a discussion. It's obviously probably the single worst thing that you can do to your body with respect to your health, and certainly when it comes to heart disease, is by far and away the single greatest risk factor for developing heart disease. I can tell you from having worked on a lot of these patients, their arteries are a lot more calcified. They tend to be a lot more tortuous. They're just harder procedures to do. It's really something that I'm hopeful that we can generate some discussion about, because, like I said, I've never been a smoker. I'm a little curious if my wife is going to weigh in on this discussion, but I'm not going to say anything about that. She was a smoker when we first met. She's not anymore. She hasn't been for many years. So there's a lot of different ways to go. Anyway, I'm not going to take up any more of your time. I appreciate you guys watching as always, and I look forward to hopefully engaging you guys in the discussion with the comments below. Thanks a lot, everybody, and have a great day.